Today, ordinarily, we come to you as Green Chat. Today, we're very excited to bring you a little bit of a different segment today. And I am joined today by CB2 Insights CEO, Prad Sekar. Prad, say hello.
Hello, and hi, Steph. Thanks for having me.
Absolutely. This is great. Since COVID, we've been operating remotely, though we speak every day and see each other on video every day. It's nice to be joining the rest of our community here and talk about the exciting new initiative that is Skylight Health Group. So, Brett, why don't you to open up and share a little bit about what Skylight is and how I'm sure many of those who are tuning in today are excited to hear about this new initiative.
Yeah, absolutely. I'm happy to. So we're very excited as an organization to introduce Skylight Health, first and foremost to our own patients. And obviously to patients who are outside of our network as well. I like to think of Skylight Health as a natural evolution for all of us here at CB2. For many years, the organization has been focused solely on patients coming to us because they haven't had access or limited access to providers, specifically around the medical cannabis certification side of patients. And what we've come to realize is over the years is that patients have been seeing a lot of our practitioners for more than just symptom management with medical cannabis, but questions regarding other aspects of their health as well. But we've somewhat been limited in what we can provide in terms of those services because the scope of our work has been so focused. So it was only natural, I think, for us as an organization to think about expanding what we provide to patients, really taking on that care coordination for the patient, helping them with more than just the questions regarding cannabis certification and usage, but rather medication management, how other aspects of their health can be improved with various other treatments. And you can think of Skylight Health really as a house of services that goes beyond the scope into primary care and into urgent care and what we'll hope to be eventually subspecialties for patients across the U.S.
Absolutely. And it's interesting to note, and I know we've mentioned on previous Green Chat sessions as well, that many of the current cannabis certification patients are a little bit apprehensive for the cannabis certifying physician to share any or even collaborate with their primary care physicians. So how do you envision that Skylight Health can help overcome those challenges that a patient feels that they are presented with as a cannabis patient?
Yeah, so certainly our focus has been on integrative health. And we've always been open as an organization to patient-led initiatives. And traditionally, when providers face the situation where they're asked a question from a patient and they typically don't have as much knowledge on it as the patient because maybe the product is not as tested or the vertical isn't as researched on, it becomes a challenge for that patient and that clinician to see eye to eye on their treatment plan. And we've really been able to step away from that the closed circle of just what's been studied and what has enough evidence to support its outcome, but rather, what is a patient asking for? We know that patients ultimately are going to do what they think is best for their own health. It's our responsibility to make sure they're doing it safely and that they're doing it mindful with the other treatments that they're on. So, the apprehension to speaking to a primary care provider about something that's more than just, it's traditionally prescribed or treated is really something that makes us different. And I think for patients who believe in holistic healthcare and integrative healthcare and still needing conventional medicine, but at the same time needing that healthcare champion to support their alternative healthcare needs, the combination of both those worlds is really what Skylight's going to offer patients. That freedom to be open and honest with their provider and work with their provider to help achieve their health outcomes.
Absolutely. It sounds like a great program. So with that in mind, I'd love to get into a little bit about the specifics, the details of Skylight Health. And I'm sure many of those watching are sitting back wondering, well, gosh, this sounds amazing. How do I connect with this program? What exactly are the details surrounding this? Would you like to speak to that? Or if not, I'm happy to jump in.
Yeah, absolutely. So I think this is really critical. This is a really big part of what Skylight Health has to offer. And it goes above and beyond what I think most healthcare providers can provide today. And that's really two things. Number one is access to healthcare that is affordable. And at Skylight Health, any patient in the US will be able to access healthcare providers under our banner for $200 a year, or better yet, for $16 a month. And whether it's a cold, a cough, an acute issue, counseling, or sometimes you just don't know where to go to get the answer, don't Google it. Pick up the phone and contact us and speak with one of the providers. As long as you're a member, you get access. And it's really simple. Anyone who's wanting to join the program can simply go to the website, skylight.health. There's a quick sign up button. You can opt to pay annually or pay monthly on an annual term. And that's it. Once you're enrolled, you can pick up the phone, contact us, and an appointment will be made, same or next day. We even go as far as even offering patients under 8 no charge. So if you're a parent, you're a paying member, you have a child under 8, your child gets access at no charge. And as we continue to grow, the benefits to our patients are going to exceed and expand as well, making more services available, more options available to patients who traditionally may not have access to it because of high healthcare costs or just limited access to providers that are willing to be open about integrative healthcare.
That's absolutely incredible. So for that price of just under $200 a year, is there a cap on the number of interactions a patient can have with a provider?
No, that's a great question. It's unlimited. So once, what you want to call once a month, you want to call 5 times a month, it's all yours to use. And we prefer that you reach out to us when you have a question. We don't want patients to feel like they can't access healthcare because either it costs too much or it's difficult to get to. And the other aspect of it is it's all telemedicine based. So, avoid the exposure, avoid having to go into waiting rooms and emergency rooms. Just see your doctor virtually through telehealth, speak to somebody over the phone if you just need some care coordination. And that's the other part. If we can't help, that's okay. We will do our best to help get you where you need to go. And that's the part of care coordination that I think really differentiates us.
Yes, especially in, unfortunately, this day and age where people are very apprehensive about stepping out into an emergency room, or even many doctors' offices currently are closed. The ability to access this care virtually is just such an absolutely incredible benefit. So I'd love to talk a little bit about prescriptions even. I know that patients have wondered if I need access to a prescription, is this a channel by which I can receive a prescription?
Yeah, and certainly there has to be some understanding that in certain cases prescriptions need to have some sort of continuity, and sometimes it might involve a provider needing to ask a few more questions or perhaps get some support from another providing clinician that the patient might be seeing. But again, if the patient needs to get access to a prescription, contact the Skylight Health group if you're a member, and we'll do what we can to help. Prescriptions, getting the prescription is at no charge. That's included in the membership. Filling the prescription of the medication, that does have a charge based on the pharmacy that the patient wants to go to, but we can work with the pharmacy the patient wants to go to. Or in some circumstances, we can also help to negotiate some prices with the pharmacies for our patients. And so we're here to help in any way possible and want to make sure that our patients don't lose access to the care they need.
Sure, that's wonderful. Another question I'm sure patients are having now is, right now, where are we currently able to provide these services for patients?
So we're expanding, we're growing. Right now, we're in 4 states. So we're in Pennsylvania, New Jersey, New York, and Massachusetts. And we just actually launched into Florida. We will be quickly expanding into a number of other states that we already operate our physical brick and mortar clinics in today. But of course, with access to telemedicine and the need for patients across the states that we're not in, we're quick to recognize our need to get to those states in order to help patients as fast as possible. And we're doing our best to be able to add enough capacity to our roster of clinicians and staff so we can make sure that patients get serviced accurately and efficiently.
Excellent. Okay, so to recap, to those watching, certainly if you have acute care issues, as an example, you're experiencing a cold, possible fever, you're not quite sure what to do, by way of this membership, you can call and have access to a provider and have those kinds of discussions so that you're not having to access your laptop and start to Google your symptoms and whatnot. Certainly chronic conditions, if you suffer from allergies or stress management, this is an avenue by which you can seek regular care. Mental health, even those who are suffering from anxiety, addiction, depression. We do have providers who are able to help manage these conditions for you. Anything else you'd like to add to that particular topic, Prad?
No, I think it's just important to mention as well. Look, we're going through some pretty unforeseen times right now. There's a lot of the unemployment rate continues to grow. Patients are falling in and out of insurance coverage all the time. And I think it's important for patients to remember that even if they do have healthcare coverage, the cost of the copay can sometimes be a barrier itself for visiting a clinician and a doctor. And so this doesn't limit the patient from being able to still have access. So the cost is meant to be low enough that a patient can still maintain both, but know that with Skylight, it's a fixed fee and that there's no incremental cost for having to come back more times or see a clinician more frequently. And in any case, we're happy to work with any primary care provider the clinician may have. So at least, they're still maintaining that collaborative care with their care team.
Excellent. Again, okay, so I just want to recap a couple of things for those who are watching, and Katie certainly is in the background populating some information into the comments. Thank you, Katie. Skylight.health is how you would access the website. There is a registration form if you are interested in becoming a member of the Skylight Health plan, the Skylight Health group. Annual subscription paid in full is $199, which again breaks down to $16 and just over $16 per month. About the price of a cup of coffee a day. I know that's pretty easy to bear for unlimited access to a clinician. And you can sign up online again by contacting Skylight.health or calling 844-644-8880. So 2 different ways that you can access if you have even just questions. By all means, we hope that we've provided you with some information here to really give you the baseline of what it is that this membership can offer you. Prad, anything in closing that you'd like to share with our viewers?
We just want patients to make sure that they get access to the care that they need. We're always patient first, so just remember, if you're a patient contacting us, your privacy is our number one concern. We're always maintaining all requirements from a perspective of confidentiality, even though through telemedicine. And we hope that more members join us because I think this is a very beneficial service for many residents in the U.S. And we look forward to continue to increase more services to you and bring you more benefits as part of being part of the Skylight Health group. And overall, just an open family that's open to alternative and integrative medicine as well as conventional therapies.
That's absolutely wonderful. And it certainly sounds like a program and a plan that many, particularly in this day and age, can certainly benefit from. So in closing, Prad, thank you very much for speaking to our viewers today about the Skylight Health Group and all of its offerings. I think it's just a wonderful and innovative new program, especially given the circumstances in the world today. Thank you very much. Obviously, CB2 Insights, this is just another revolutionary offering of the CB2 Insights company that really strives to aid patients in achieving their healthcare goals. So Prad, again, thank you very much for joining me. I appreciate it. And thank you to our viewers. Have a wonderful day.
Have a wonderful day.